The Optimal Weight for Life program is one of the oldest multi-specialty programs for overweight and obese children and their families in the country. Childhood obesity is a chronic condition which challenges many primary care pediatricians to manage. And we know that there's no one simple treatment for childhood obesity in most cases. The place that we begin is with nutrition, to try to understand how whole, natural, slowly digested foods can support metabolism, decrease hunger, and help an individual to lose weight more naturally without as much struggle. Then we need to bring in the right approaches to physical activity. Children are not designed physically or psychologically to spend 20 minutes on a treadmill every day. Instead, we need to figure out ways to make physical activity fun again. And then ultimately, we need the right behavioral practices that can help a child incorporate a healthy diet and a physically active lifestyle more willingly.
We came to the OWL clinic because Julie had some brown skin on the back of her neck, and the pediatrician was concerned that it could be adult onset type 2 diabetes, so she wanted us to get her healthier. Before we started this, takeout was huge in our family. You know, I work part-time, and those nights I worked, takeout. Go grab pizza, whatever, McDonald's, drive-through, anything. That was easy. Didn't exercise much at all. After coming here, we've since joined a health club. We swim 3 to 4 days a week. There's maybe takeout once a month. Total change in every kind of food in our house. I myself, just by changing everything, have lost almost 35 pounds. And trying to figure out your meals can be very difficult until you take one little step at a time. Don't change everything at once, and you just, do little changes, baby steps. First Appointment was wonderful. They were so nice, so helpful. A lot of information given to us, but they said we could call them, they can help us through it. Everything is directed towards Julia and making sure that we know it too, but it's all Julia this and Julia that.
Well, it was a little weird at first because I didn't know what it was going to be about. I figured out that the people were really nice.
Long-term changes, I think we're just going to keep what we're doing. She's growing, it's getting thinner, I'm, getting there. I think long-term we're going to be very healthy people.
In school, people say to me, "Wow, you look great." And the librarian said to me, "You're rocking your jeans." It makes me feel really good that what I've done is really improving in myself.
Her whole feeling of how do I look, and she's not down on herself anymore, which we used to have a problem with. She just is a whole happy, she's always been happy, but much happier little girl.
Hello, I'm Dr. Amy Fleischman, one of the physicians in the Optimal Weight for Life, or OWL program. I'm going to speak today about what the medical visit consists of in the OWL program. Initially, you and your child will be evaluated by a physician or nurse practitioner. This will include an extensive medical history, family history, and personal history for your child. We're going to evaluate whether there are causes for obesity that we might be able to evaluate and treat. And we'll also assess whether the weight gain in your child is causing other medical problems. We'll also assess an extensive family history to determine the risk factors for your child, particularly interested in things like diabetes, high cholesterol, and high blood pressure that might run in the family and increase the risk of these problems for your child. Your child will also have some laboratory studies, including blood and urine analysis. The child will have blood pressure and heart rate done, and then an extensive physical examination, such as would be done at your primary care provider's office. At the end of this evaluation, we'll be able to discuss with you some potential interventions, lifestyle modification changes such as nutrition and exercise, and also potentially discuss referrals to other providers to evaluate and or treat some of the medical problems that we identify. After this initial assessment, we'll come up with a plan for you and your family. This will usually consist of returning to see your medical provider in the OWL program at least every 3 months for ongoing assessment of the medical problems that we've diagnosed, as well as assessment for any problems that arise.
My name is Maura McNamara, and I am a registered dietitian here at the Optimal Weight for Life Clinic. And the nutrition component of our program consists of working with families to achieve healthy weight. And we work with families on lifestyle changes. We work on healthy choices, education, and lifestyle changes to achieve sustainable weight loss. So how our treatment process works is a family comes in and then we do a detailed analysis of the patient's actual intake. And from there, we assess it and then we set goals. And we work on the small change theory. So rather than saying to a family, you have to change 15 things, we pick 1 to 3 goals that are mutually set, that the family feels are doable, and we focus on that. We follow up in a follow-up consult on what were the goals that were set at the last visit, how are things going, and what can we continue to work on. If there are particular barriers that have been in the way of families being successful, we talk about those, and again, we really individualize the counseling. So after the initial appointment, which lasts an hour, our follow-up appointments run for a half hour, and we like to see patients back within after a month of their first initial visit, and thereafter we see patients every month. The patients who are really most successful here are the ones who read our menu booklet and follow it. And the importance of keeping regular appointments is that it helps keep everybody on track, keeps our families accountable, and allows us to continue to set goals.
I'm Tomasio Burton. I'm a behavioral medicine provider here in the OWL Clinic, and our role here is to be supportive of families when they get recommendations from the nutritionist or from the physician about making healthy lifestyle changes. We know that all families are very different, have very different lifestyles, and we really want to get to know you well and make sure that the recommendations that we're making in other parts of the program make sense for your life. In the very beginning, we'll assess for issues like anxiety, depression, self-esteem, to see if any of these things are getting in the way of being successful in our program. After our first visit, we like to meet with all of our families in about a month, just to do a quick check-in about how progress is going. We like to hear when things are going really well, and we also like to hear when there are any kind of problems or barriers that are going on, so we can work together and brainstorm on ideas to make things go better. We want to know how things are going at school, how things are going at home. All of these things influence weight management and how successful you can be in our program. So change takes place across the entire family, and it's really important to realize that everybody in the family plays a role in your child's success. So sometimes we'll work with your child about ideas to keep motivated or to make these changes, but a lot of times we'll also want to work with parents and other family members to make sure that everyone's on the same page about how we're going to put these recommendations into place. We want to help keep you motivated, so we break down the recommendations that you get from the other providers into small, manageable pieces so that it's not something that's overwhelming, it's not something that you feel like you can't handle. And, that's another really important reason that you come to see us is we want to make sure that it is something you feel like you can handle. We want all of our families to be successful, so if you feel like something's not going well, talk to us about it and we can work on it together.
My name is Adrienne Bonita. I am the resource specialist at the OWL Clinic at Children's Hospital Boston. Here at OWL, we understand that parents want what is best for their children, and sometimes it's hard accessing the right resources for them. With the resource specialist available, we can help guide them to whatever it is they need in order to obtain a healthier lifestyle. There are a few different ways I connect with the families. I often meet with them in person and talk to them about different options that are available, and sometimes it's more convenient to communicate with them through email or phone. Exercise plays an important role in achieving and maintaining a healthy weight and preventing disease. Some of the things I've assisted families in finding are therapy referrals and physical activity programs in their community, and I've also helped parents become better advocates for their children at school. At OWL, we will work with patients and families to set meaningful goals, make gradual changes, and teach them how to be active for a lifetime.
I'm Joyciana Fidalgo. I'm the ambulatory service supervisor here for the OWL program. I'm going to talk a little bit about the scheduling process here in the program. So we have a very large administrative staff that's here to support families and support you in getting appointments with us as soon as we are able. We're here to help accommodate you with services that we provide with the nutritionist, with the doctor, as well as a behavioral specialist. We are currently seeing patients in Boston as well as Waltham. We're hoping to further our services to satellite offices. Please be sure to contact your primary care physician or PCP and request that they fax over any labs, clinic notes, and growth curves so that our doctors can prepare for your visit here in the OWL program. We appreciate when families arrive at the time requested before the scheduled appointment. This will allow that you are given the time needed to fill out any paperwork as well as get heights and weights done. That will also allow you to spend the time needed with the providers to ensure that you're getting the best quality of care. Our program has a diverse patient population, and the hospital will offer interpreter services for families that would prefer that an interpreter be present during the visit. We also have books both in English and in other languages. There are a lot of insurance issues that we have come across due to the contracts that we, Children's Hospital, have with some insurances, especially with mental health. The administrative staff will work with the primary care physician's office to obtain the proper referrals and authorizations needed for your visit in the program. When you are done with your visits, please go to the front desk to be sure that you've completed all necessary paperwork as well as made follow-up appointments.
I first became involved in the program with my daughter Cassandra several years ago at the OWL Clinic. They were concerned about the fact that she was, her body was retaining the sugar, like holding on to that, and they were concerned that like she had pre-diabetes. With Kyle, they suggested that that he make diet changes. Kyle loves bread, he loves pasta, he loves rice, so we cut back on those type of things.
I changed. I stopped eating big snacks.
He used to kind of be stuck in a rut and in a place where he didn't talk a lot and not socializing with everybody. So since it seems like he's been here and drinking more water, Crystal Light, the sparkling waters, just making the diet changes, and I think him moving that body, me finding things to move that body, and making it fun to move the body though. You have to find something fun, and he's been happier.
I think that people that do exercise and be healthy live longer lives.
We do appreciate you coming to the OWL program, and we look forward to working with you and your family.